Good evening. It's 6 o'clock. We're ready to go live again with our third reentry webinar as part of our Baldwinsville Central School District reentry webinar series. I'm Joe DeBarbary, the Deputy Superintendent here in the district, and tonight our focus will be on special education services and supports for students. We thank you in advance for your participation tonight. We greatly appreciate the feedback. And we look forward to sharing our plan with the community this Friday when we submit our plan to the State Education Department. A few quick reminders regarding the webinar. If you could please assist us this evening, all the panelists are happy to answer questions and I'm happy to facilitate your questions to them. We're asking you to please submit those questions under the Q&A section of the Zoom platform as opposed to the chat section. The reason we're asking you to do that is it allows us the ability to save those questions and then put together our own Q&A, which we can have published at a later point in time to help support families and clarify any communication that we have as a district. If you are viewing this event live on Facebook, which we know we're live right now, please understand you won't be able to participate in the surveys. However, we have again, showcase the questions so that you can participate online if you want. They will not go into the tallies that you see through the webinar. This webinar is being recorded and it will be posted at a later point in time. We'll shoot again for tomorrow morning by 9 a.m. to have it on our district website for those that are unable to join us this evening. And as always, please, this is a reminder, this is a public forum and we're asking you to be respectful with the communications. So thank you again in advance. Let's move forward and take a look at who we have on our panel tonight. So we're happy to have with us Rocco Nally, our Director of Special Education, Carrie Lamacchia, our Director of Pupil and Personnel Services, TJ Frere, representing secondary principals, our principal at Durkee Junior High School, Melissa Chido, representing the elementary principals, principal at Reynolds Elementary School, and representing our school psychologist, we have Jenna Wolkin, who is a district psychologist within both at Ray Middle School and doing some support within the district setting as well. So welcome to all of you. Before we get to the meat of tonight's presentation, what we'd like to do, like we've done with all of our, is to just recap what are the reopening models that we have available to us. We have to submit a plan as a school district to the State Education Department, focusing in on in-person instruction, remote instruction, and hybrid instruction. And as I've shared in other webinar series that we've provided, it is highly unlikely that there will be full in-person instruction for every single student in the district. It's just not feasible given the space, guidelines, and restrictions for health and safety that we have. So from our perspective, as you see, even though we are submitting a plan to the state for full in-person, it is highly unlikely that will be the end result come September. So again, we're going to try to focus in on how we can better support our students with disabilities and those receiving special education services through remote and hybrid options. So let's get a sense of who we have on this call. So I'm going to go ahead and start a poll like we do with our other webinars. So if you could please respond to this first question. Let's get a sense of who on the call is feeling most confident about which option for our students in September. Give you about another 3 seconds, I'm sorry, to end. Put in a response. We're going to go ahead and close the poll at this time. I'm going to share out those results. So as it stands now, 21% looking for in-person full return, wearing face coverings all day. 23% are hopeful for the remote or online instruction. And then the final hybrid model or schedule, which is in-person and remote, we're looking at about 56%, feeling confident with regard to those options. Okay, I'm going to stop that poll, and we will move right into the focus of our presentation this evening. And to start us off is Rocco Nally, Director of Special Education, and he's going to talk to us about the requirements. So please, again, if you have questions, feel free to send your questions through the Q&A portion, and I will be certain to ask as we move throughout tonight's presentation. Thank you. Rocco?
Good evening, everyone. So I want to just first, just indicate that I'm going to give you a sort of a broad background on how things kind of left off back in March when schools shut down, and requirements that have come out since then from the Department of Education, as well as the New York State Education Department, and on what we need to do with regards to our reopening plans. But then our panelists are going to really get into much more detail with you guys on specifics on the best we know at this time, how we're going to support students with disabilities as we plan to reopen in September. So with, the background, in special education, we are always governed by the Individuals with Disabilities Education Act. It's federal law that requires specific programs and services to be provided to students, to provide them with what we call FAPE, or a free and appropriate public education. And so when things shut down and the pandemic happened in March, we did receive guidance back from, again, the Department of Education from the federal level that stated that those FAPE requirements were not going to be relaxed per se, but there was given some flexibility during this emergency shutdown of services. So in essence, we are required and will continue to be required to provide students with a free and appropriate public education, but at the same time, doing it in a way that's consistent with meeting the needs to protect the health and safety of our students and our staff. So our reopening plans in September must provide a framework to ensure that all students with disabilities continue to have available to them this FAPE that emphasizes special education and related services designed to help them meet their unique needs. So we have to be very individual in our approach to this. And again, this is going to be really shared on more as we get through the presentation, but that is the framework that we are taking and continue to take. Additionally, we are emphasizing, and we're required to, but we in Baldwinsville feel like this is a major point of emphasis, and it has been for some time, to have meaningful engagement with parents and collaborating with those parents. So when we shut down in March, we made it a requirement that our special education staff minimally be reaching out to families and the students at least weekly, if not more, finding out what is the greatest mode of communication with those families, what works best for them, to understand the specific circumstances and needs of the family, along with those individual unique needs of the student, and how can we work together and collaborate and engage to support those students the best way individually in the circumstances. This is something we plan to continue in September. So our reopening plans aren't going to be very rigid, and if you're in co-teaching, you get this, and if you get related services, this. It's rather we're going to be, again, looking at the unique individual needs of the students, being flexible, collaborating with families to meet those needs. It's really important for us to also look at collaborating with the services that are provided outside of Baldwinsville. So we have in district, we have all our special ed teachers and service providers, but we also have agencies and providers outside of district that we have to work with and collaborate. So the CPSE, our Committee on Preschool Special Education, we as a district have plans. We're working this summertime with coordinating with all of the different agencies that are approved by the New York State Education Department to provide preschool special education services and programs to preschoolers with disabilities, whether it's in person or remote, whether it's in a daycare, in a home, however that is, the location occurs. We are going to really have to work with each of those agencies to make sure that they are fully aware of how to best implement the IEP. How are they doing that? What resources do we need to kind of share between us to support them in providing those supports to students, and make sure that those agencies have procedures in place to protect the safety of the students as well as their staff, and communication with the parents. Similarly, at the school age level, we have to do the same thing with other providers outside our district. So for example, BOCES, we have some Baldwinsville students receiving programs and services through our BOCES partnership. And we are this summer been having constant communication with our BOCES and collaborating with them on, again, how do we work together to ensure that our students in Baldwinsville's needs are being met when being provided with services outside of our district.
So Rocco, Rocco, do you mind me interrupting just for a moment? Because I do see that there are questions about the BOCES program, students that attend BOCES programming and services that they receive. So just to clarify for those on the call too, BOCES is committed to, we're working with them. We have in-district programs, BOCES programs within our facilities, and just like other school districts, we have all committed, and BOCES feels confident that they can support the instruction of students within those programs every day of the week within the school settings across the region. So I just wanted to make sure that that was clearly communicated to families, and there certainly will be more information as all of the districts and BOCES reopening plans are submitted to the state, but we're very hopeful that we will be able to accommodate all of the students that fall within those programs. And that also includes CTE programs at the various levels as well, career and technical education for those that aren't familiar. So I apologize for interrupting, but I thought it was important to just highlight that given your last statement.
Yeah, absolutely. Thank you, Joe. Next, I wanted to kind of just quickly, emphasize that special education, one of its key components is, ensuring access to general education for students with disabilities. So the way we ensure that generally is through the accommodations we provide in school, the modifications, supplementary aids and services, and technology or assistive technology. And this couldn't be more important as we look at the different models of reopening in September. So if we are in a hybrid model where, for example, we're 3 days in person and 3 days remote, or if we're fully remote at some point or other, families especially need to have the resources to support and ensure that because of the students' unique needs, they have the access to what is being provided to them. So if students have vision impairments and are at home, or hearing impairments, reading disabilities, things along those lines, how we provide that remote instruction or support has to be fully accommodated with that in mind, so that students with disabilities have that full access. We are required to do documentation. That's something, that's on our end, but we will continue to do where we're documenting what we're offering, to students with disabilities, but also the actual what has taken place for those students with disabilities. Another very important piece that was made clear to us back in March when things closed, and continues to be the case in September, is that we have to progress monitor students. That's, it's a critical piece in special education, collecting data, getting data points, whether we're in person or remotely, to monitor each student's progress towards meeting their annual goals, because this is a way for us to evaluate the effectiveness of the program and services that those students are receiving. So determining that student progress is really necessary, and that will also help us to make determinations in terms of if a student, if what extent or whether a student during the closures back in March may have disrupted that student's learning, and we might have to look at providing additional supports to those students. So again, progress monitoring becomes very important to us. And lastly, I wanted to kind of talk about is that the state has, in their guidance for reopening, indicated what's required of us, and then also what they sort of suggest to recommend what's not required. And they're suggesting, if possible, that we make plans for in-person services additional for high need students. And in Baldwinsville, Carrie Lamaki is going to talk a lot more about this when she gets on, but we made it a high priority this summer to provide in-person services for students with disabilities. And we want to, again, in September moving forward, whether we're in a hybrid model or a full remote model or whatever model we're in, that students with disabilities we're prioritizing, and we're providing them with more than just what is the model that we take. So we're going to do that again as an individual basis. It's not going to be prescribed where if you have this, you get this. We're going to look at each kid individually to their unique needs and make determinations on that. But minimally, we'll be looking at kids coming in more than just those 3 days a week, getting some additional support and services from either a special ed teacher, from the related service provider, however that works best for the students. And obviously we have to, again, ensure that we're protecting the health and safety needs of our students and staff. So it has to be in line with that, but that is our plans moving forward, is that approach. So it could be a continuum where a kid is coming in just an extra hour for like a one-on-one with a teacher for some supplementary instruction, or up to maybe potentially a really high needs kid coming in 5 days a week, even though the rest of the school is coming in 3 days on, 3 days off.
So just to clarify that, because I see there's a lot of questions related to that, students based on their IEPs that have multiple therapies listed, there is the district talking about how to accommodate those students potentially up to 5 days a week in person for periods, or if not the whole day, to accommodate the needs of those services being provided. Is that correct?
Yeah.
You're muted, Rocco.
I'm sorry, I unmuted muted myself instead. So we want to do this to the greatest extent possible. So with related services, that might be a little bit complicated with, because say we have one speech therapist for an entire building, and if there are 3 days on, 3 days off, we are going to want to emphasize that that speech therapist is providing services for the kids that are on in days. And so it doesn't really give them break time for additional support. So we have to kind of figure that. But even with a 3 days on, 3 days off model, we typically see speech therapy, OT, PT not going much past that 3 times a week period. So we want to, like, again, as much as possible to the greatest extent, follow those needs, but in a streamlined manner, and which we'll get to from some of the other panelists.
Thank you. So why don't we take another poll real quickly. We're interested in knowing the concerns as they stand right now. And again, this is just a quick poll. So if those of you on the call, the Zoom call, could respond to this question. Those of you that are on Facebook Live, the question we're asking is, what are you most concerned about when thinking about your child returning to school in September? Is it the child's IEP being met, the health and safety, returning to that in-person schooling, social emotional well-being, or other? And certainly we recognize other as, there's a lot of options there. So if you want to use the Q&A to provide us a little bit more detail of what that other might be, please do that. You may also utilize the chat for this specific portion if you'd like. We'll give you another 10 seconds to respond, and then we'll share out results, and we will transition to what this might look like more specifically within the school setting. Okay, I'm going to go ahead and end the poll and share out results. So 24% are concerned with the IEP being met. 37% are concerned with the health and safety returning to in-person schooling. 28% are concerned about the social emotional well-being of students. And then 10% have used and chosen to identify with that other category. So again, we appreciate your feedback. And with that, we're going to transition right to a summary of some of the webinars related to special education supports. And for that, I'm going to look to secondary principal TJ Frere to describe what the district has been working on.
Thank you, Joe, and good evening. I would like to start by echoing a comment that you'll hear our Director of Secondary Education, Renee Burnett, continually tell our teachers as they work this summer, and that's our kids are not broken. We do realize that there's some gaps in learning that, but we're committed to addressing these gaps through grade level content. We have the confidence that our teachers will meet all our students where they are in their learning, and with each of them, and get them where they need to be in order to find their success. As a district, we met the challenges head on that COVID-19 brought in March. But what makes Baldwinsville Central School District a special place is we continually reflect on our practices and realize that we need to improve in some areas to benefit our children. We want to work with the community to help make these changes or improvements. Our teachers have been working very hard this summer to prioritize their curriculum for all students to ensure that they're prepared for the upcoming school year, while also anticipating that at some point we may be in some sort of hybrid model of learning. They've also been working closely with our special educators to develop accommodations to their planning that will better meet the needs of our students with disabilities. New York State curriculum is notoriously has a tremendous amount of curriculum content to cover in 1 year. We've always known that students with disabilities highly benefit from prioritized curriculum to give them more time to master the most important skills needed. This year, we're confident the students will get this prioritized curriculum. Through the feedback from you and our staff, we've identified some areas that we as a district need to improve upon when teaching virtually, either synchronous or asynchronous, to benefit our students, especially those with special needs. Our teachers have been working to be more consistent with the virtual learning platforms they will use, such as Seesaw at the primary levels or Google Classroom at the secondary levels. We've also identified that we need to provide students with a more consistent daily schedule when learning is virtual. We believe this will help help our students find the success they need. We also recognize that parents as well as our students may need support and training in these virtual learning platforms that we choose to use. Our library media specialists throughout the district are in the process of developing tutorials that will assist parents and guardians in the use of these virtual platforms. Also, if your child utilizes special assistive technology, support will be provided further to families working directly with your child's special education teacher, teaching assistants, or district assistive technology specialists. Finally, we know that many of our students have been impacted socially and emotionally with the COVID-19 pandemic, and that this has been particularly hard for many of our students with disabilities. We want to assure you that we understand that this is a major concern and that we are focused on supporting students both emotionally and academically when we return to school. This coming Thursday, we have another webinar devoted strictly to the social and emotional learning of students, and we would like to encourage you to also watch that webinar if possible. Thank you for your support that you've shown during this difficult time, and in the true Baldwinsville way, we'll get through this together. But thank you.
So before we transition to some elementary comments from Melissa Chido, principal, I've seen a few questions come through, and I would open this up to anybody, maybe Rocco or Carrie, specifically with regard to OT, PT, speech services. If a family is looking to have their student out on remote instruction the entire year, let's just say, will there be opportunities or that flexibility to provide on a needed basis the speech, OT, and those services in person if the family is choosing, the remote instruction for everything else? So has the district been talking about that, and is that a possibility given that there's conversation about 5 days worth of potentially instruction for students that are more considered high needs?
So, yeah, we've been thinking about this. Obviously, it's very important, and as you know, things, you know, as we continually grow in our plans, you know, we are trying to adapt to that. But I would say, you know, at this time, the answer is yes. Just as we talked, or we'll be talking about summer school, we would look at kids potentially coming in for related services. So we know that those are some of the hardest things to deliver remotely is those therapies. Those are like medical therapies we receive through occupational therapy, speech therapy, physical therapy. Those are things people receive in hospitals and clinics. It's medically based. And so when we went into the remote manner, that was, some of our kids really had the toughest time responding to that. So the, you know, the broad answer is yes, we want to look at that. The only, you know, caveat I would say is that it probably, I don't see how we could do that one-on-one because those therapists will be maxed out with the services they're provided by. You know, this is my anticipation is that they're going to be booked and scheduled with services every half an hour for the day, and that if they're going, you know, if kids are coming in 3 days, and then the other group of kids are coming in the 3 days, they're scheduling their services in there. So families that opt for remote only but want their kids to come in for related services, they might go in and get their speech therapy with a group of another 1 or 2 students, again, as we meet the health and safety requirements necessary there. But that's what I would think.
And I would say too, a couple additional things that we would need to consider just going through this with the summer program is transportation. You know, we're able to do a lot of things with flexibility right now during summer, but during the school year, there's going to be things are going to be a lot more complicated with transportation. So what does that look like? Is the parent willing to transport? Does the parent want their child to receive transportation? Does their child need a TA assigned to them? Is there someone available during those therapies and that very complicated schedule that we're talking about to get that child off the bus? If they've opted to not have their child in school, what happens to potentially that teaching assistant that was assigned to them?
I appreciate the responses to that, and certainly there's more to come with the finalization of our plans, and we'll talk more about transportation and what options families have with regard to that as we move forward. So thank you. Let's transition to Melissa Chido, who's going to talk a little bit about the provision of services that would be provided for students within the school setting.
I need to unmute myself. Thank you, Joe. Good evening. So students with disabilities were particularly impacted by the closing of school in spring of 2020. In some cases, these students were unable to fully access programs and services they needed, particularly the programs and services that are best delivered in person. Until schools reopen to normal operating conditions, the same flexibility with respect to IEP implementation for delivery of services during school closures due to COVID-19 continue to apply. Consistent with previously issued guidance, school districts must ensure that to the greatest extent possible, each student with a disability can be provided the special education and related services identified in the student's IEP. During the 2020 and 21 school year, due to the health and safety requirements that must be in place when schools resume, schools may not be able to provide all services in the same mode and/or manner they typically provide. Baldwinsville in-person instruction will meet the health and safety requirements in a manner that does not result in unnecessary separation of students with disabilities from their non-disabled peers. This has been particularly trying time for all members of our school community, and particularly our students with special needs. We've been receiving questions from staff and parents regarding how we're going to utilize our paraprofessionals, specifically teaching assistants who work with special needs students. We'll be reviewing our instructional practices to plan for the necessary accommodations for students with disabilities to progress in the general education curriculum. This includes how we utilize teaching assistants to best ensure equity and access to the general education curriculum in consideration of students' unique disability-related needs. In addition, multiple platforms will be utilized, such as Zoom, Google Meets, one-on-one Google Meets or Zoom, in-person therapy while maintaining social distancing. Ongoing collaboration with parents and school staff will be extremely important at this time to ensure student success. The health and safety of the children and adults at our schools is paramount, and health and safety considerations must always come first in every decision made and every action taken by our schools and districts.
So Melissa, because I am seeing quite a few questions, so maybe expand a little bit further, or TJ, on that TA support and what that might look like in an elementary and in a secondary setting, if possible.
Yep, depending on the model, whether it be hybrid, remote, in person, what the plan is that, students will have that support. If they need that small group support, they'll be integrated into a small group. If they need more one-on-one support, they will have another Zoom meet or Google Meet in addition to meeting with the teacher. It will really be based on student needs, what we're hearing from our parents, making sure that they're continually, communicating with us and the teachers, and all of those pieces. We don't know what they will look like, so we're going to be modifying and adjusting as we go to make sure that we're meeting the needs of our students.
I would just say at the secondary level that the TAs that are assigned to the classrooms will still follow those students and be able to assist those students in the subject areas that they're finding that they're having trouble in. But as always, if they don't have a teaching assistant in that class that they're struggling with, parent can certainly reach out to probably the district, or specifically the administrator in the building, and we can get them the support that they need.
Okay, perfect. Thank you. Let's transition to our preparations. And so I really want to focus a fair amount of time on this area, just because it has helped us, I believe, develop more closely our plans for what we believe instruction will look like. We're thankful that we had the opportunity to continue our extended school year program this summer. And so Director of Pupil Personnel Services, Carrie Lamacchia, will walk us through what we've been doing. And she certainly has the firsthand view, being also the one that oversees the extended school year program this summer. So Carrie, could you talk to us a little bit about our preparations within special education?
Sure. Thanks, Joe, and good evening, everybody. Yes, we know that we've heard many questions from our families, whether it be through email, phone calls, different modes of communication, previous webinars, that there are lots of questions and concerns about bringing kids back in the fall or students back in the fall, and our staff being concerned as well, and how are we going to do this? So we really thought it would be helpful to speak to you a little bit about what we've been doing for in-person services this summer, but with a little bit of background, because we know there's probably people listening whose children were not recommended for services and are not aware of maybe what happened in the spring regarding the recommendation for extended school year services. So at the end of May, we were told that we would not be doing in-person services at all for extended school year for those that were recommended for those services and programs per their IEP by the Committee on Special Education. And then in early June, the governor issued an executive order stating that special education services and instruction may be provided in person for the summer. So we very quickly began changing our plans, waiting for their guidance, only a few days later to receive guidelines from the New York State Department of Health, which outlined the health and safety requirements necessary to provide those services. And what we found was that we weren't sure we were going to be able to do that, simply because we had very limited amount of time. We didn't know if we could get the supplies we needed. We were just reading those recommendations and guidelines at that point in time, trying to understand them. But we also wanted to make sure that we were prioritizing the needs of our students. And through the annual review process, we're hearing from families, like Rocco had said earlier, that our high need students who receive OT, PT, and speech were really struggling, and that those services weren't working remotely. And so our students that are recommended for summer services are typically students that would regress anyway. So we really wanted to make sure that we were providing those students with those significant needs, those supports and services they needed. Like Rocco said, really paying attention to the individual needs of our families, but also taking into consideration the concerns and the safety and health risks that were out there. I do think it's really important to say that from the start at the district level, we've worked with the nurse practitioner, our facilities department, transportation, the superintendent and his cabinet, directors, our lawyers, as far as developing and thinking about those safety procedures and guidelines for in-person services. We knew that we had to very carefully balance the needs of our students with what we could do to keep students safe within the school environment and bringing them back. But also thinking about that in the fall, hopefully things would be much less restrictive. We wanted to be as strict as possible with the summer. This was the first time kids were coming back. So we were able to implement those services on a one-to-one basis and do some things very strictly to ensure that safety. So we were 100% confident that we could bring them back if we could work with parents and their own, like Rocco has said too, their comfort level, their family's individual needs and what they preferred, whether they wanted those services remotely, whether they wanted them in person, and how we could best ensure to meet the needs of each family and student. We currently have about 139 sessions running at summer school, providing speech, OT, PT, teacher of the visually impaired. We've added counseling recently, and we did also start completing psychological evaluations that we had previously put on hold because of some of the restrictions in the school closure. About 83% of those that were recommended to participate in in-person services are participating. I would note too that some of the safety precautions that we put in place, it is a good model for the school year, but some of those things, you know, as families and as a district, we really have to consider. Like I said, all of the services are one-to-one, and that would be very difficult to continue to do as the school year starts, especially if we have a certain number of providers or we're on a hybrid model, what that might look like and how we would continue to do that. A lot of our students with significant needs cannot wear a face covering. So we're working with families on who those students are, and we put additional measures into place where they socially distance, they get off the bus alone, they do their health screening, and no one is in the hallway at the same time. So that's a very strict level of safety and precaution that we're taking at summer school that we would have to consider how, not saying it can't be done, but how we will do that in the fall with more students in the building in order to keep everybody safe if we have a student that is unable to wear a face covering. We had to come up with procedures for health screening, and then sanitizing, and again, looking at those things like hallway transitions. We also have our teaching assistants or anybody escorting a student, if they're escorting a student without a face covering, wearing a shield as a secondary precaution. So those are some of the things that we've been doing that we'll be thinking about how we might continue to implement those things in the fall for some of our high needs students. Additionally, we wanted to talk a little bit about some of the ways that we're going to continue to support families and students, regardless of what model we end up with. One of the things that happened in March when we had the school closure, once we realized we were going past 2 weeks, in this district, we currently have a PLC model where we're able to do a lot of collaboration, and our department's already set up to meet monthly. We quickly switched to remote and we're able to continue doing those, running those meetings, and that provided a great foundation for us to talk about how things look differently remotely, how we could work with our individual families, share tools, and work with different strategies, whether it be remote. And we'll continue to do that in the fall as we transition to different models or as things change throughout the year based on the recommendations. It also provided a great self-care option for our staff, I believe, because our staff was able to really connect through their own stories, their frustrations, how they were coping with different things, and how they were supporting students through these online platforms. Finally, we'll continue to look at different professional development options. We've always been very collaborative in this district and provided professional development for our staff before the school year starts so that they can familiarize themselves with the student's IEP. And really sort of hone in on, like Rocco said, those accommodations, those modifications, and really looking at the specific needs of students and working with the regular education staff, the related service providers to provide those supports, access to the curriculum, and then specially design the instruction based on whatever the lesson or the curriculum is. We will continue to do that. We'll provide that time. The difference being now our staff, hopefully once we have a plan, we'll know what does this look like if we're hybrid, if we're in person, if we're remote. You know, we have a little bit of experience behind us with the remote now, so I think that really will help us moving forward to whether we're hybrid or remote or in person. What does that look like? And start off the year really with those days to look at those IEPs and specially designed instruction to ensure we're providing each student with what they need. And again, working with those families as things come up, what is it, whatever the recommendation is, what's your preference, what's your comfort level, you know, how can we help you? You know, I'm seeing lots of things in the chat, families saying things like, you know, what do I do if I don't have daycare? What do I do if, you know, my son's walking away from the computer? Those are all things we can consider and talk about on an individual basis if we know them. So once we know where we're going and we have those IEPs and we have teams looking at them together, we can reach out to families and really work with you to partner to make sure your students' needs are being met.
So you talked a little bit about the PLC model and utilizing a couple of questions I see on here relate to key point people within each building supporting families so that every provider is not necessarily calling or emailing every day families. Is that part of the conversation? And are we looking at within each school setting for each child, whether it's the special education teacher or a specific service provider, you know,
Sure.
being the main ally or support for a family so that there's that check-in?
Sure. We talked about, you know, I think in the spring when we, like I said, it was recommended 2 weeks, and then we went to 2 more weeks and then 2 more weeks. We were just trying to do everything to reach out as much as possible. And I think we did receive that feedback that, you know, some families were overwhelmed or inundated with these phone calls and emails, and this is too much. So, you know, Rocco and I have discussed this, and I think he may have mentioned it, that the special education teacher really is the case manager. You know, they're sort of the expert in the IEP. They collaborate with and sort of lead those discussions with the other providers.
Mhm.
For most cases, like I said, that it's very individualized. Some students might have only speech. So in that case, the speech therapist may be the case manager or the contact person for the IEP. It really can depend, but I think that is definitely something moving forward. When you know, Rocco, you can jump in if you have anything to add, but I think moving forward with those professional development days and when they're collaborating on IEPs, we can definitely make sure to focus on.
Yeah, I would just reiterate exactly what you're saying, Carrie. That's definitely the feedback we've been getting, and we recognize that this is really important, that the communication that occurs with parents really needs to be, you know, thorough, but it also needs to be streamlined and predictable. So I think those are the 3 kind of key pointer areas that we're going to work with our teachers and providers on, so that there's a plan in place that is streamlined, that gets the information to the parents as needed, and that it's a mode that the parents, you know, works best for them, and it's predictable for them, so they know when it's coming, kind of. So very critical.
Perfect. Thank you, Rocco. Let's transition now to a psychologist perspective. So we talked earlier a little bit about, you know, that progress monitoring and what things look like for students. Let's talk a little bit about monitoring the services and the changing needs of supports for students and needs. And for that, we're gonna, you know, look to Jenna, and then Rocco and Carrie can certainly chime in as needed. So Jenna?
Everyone, and just to wrap up, so during the school closure, we've recognized many things have changed for our students. From March until now, a lot has gone on, and now more than ever, we have to monitor students' progress and assess their needs. When we held our reviews in the springtime, this was very evident that students were not showing new needs or their needs had changed due to the closure. There's also a regression noted for students across the board K-12. What our plan is moving forward is to continuously monitor our students' progress and needs accordingly and quickly. And the best way we can do that is what Rocco was talking about earlier, that meaningful partnership. So if parents do feel that you have concerns about your child's IEP, please reach out to us. You can start with your special education teacher. You can start out with school support staff, including school psychologists, school counselor, social workers. And we will work together to make sure your child's needs are being met through the IEP. We can always come back to the at any time throughout the year. So please don't wait. One way we can assess needs is through evaluation. We will still be doing evaluations throughout the year, as it is the district's responsibility to identify educational disabilities, whether in person or remote. However, it's really hard to keep some students because of learning. Sorry, I'm just making sure you guys can hear me in the chat.
There's a few every once in a while. Just to kind of reiterate, the special education teachers, you're in the process of talking, I believe, now about the evaluations and if there needs to be reviews of the IEPs and the services and supports. So maybe pick up there, and Rocco or Kate.
Yeah, I apologize. I'm at home. My son isn't great. I can see. Okay, let me try to speak clearly. So it's talking about the evaluation, how again it's a responsibility to identify educational disability. To really just distinguish between, for instance, struggle with learning and then is a disability. Again, we're building teams, so just to consider what steps to take with that. And also, I want to know, acting evaluations this year, we're actually, I'm sorry, am I breaking up? I mean, we are conducting the evaluations this summer, and we started at Raymond School. I'm sorry, Joe, do you see the chat? A lot of people can't hear me.
Yeah, I turned off your video, and you seem to have cleared up quite a bit.
Okay, good. So I'll finish the evaluations. But really, so when we talk about evaluations, we really prefer in-person evaluations just because it's the most ideal setting. We build rapport with the students. We want to observe the students, they problem solve. So we're really going to strive to continue to do in-person evaluations with the students. And we're really following those guidelines that Carrie mentioned with summer school. So hopefully we continue that throughout the year, whether we do a hybrid or remote option. And then, with our CSE meetings, we did have luck with the Zoom meetings. So that could be an option moving forward to either have a Zoom meeting if parents don't feel comfortable coming in, or if it's easier for them to access those meetings. So we'll have that option as well. And I apologize for those who couldn't hear me initially, but if there's any questions, I'd be happy to answer.
I'm scanning. I don't see any questions quite related to what you've said. Is there anything, Rocco or Carrie, you wish to highlight based on what Jenna shared? Just to clarify, we still have 12 minutes on the call, and I certainly, will take more questions.
I think maybe I can just kind of quickly talk to the initial part of Jenna's presentation when she was, before the technology got cleared up somewhat. So the most important piece is that, and I referenced earlier on, is that we recognize that with the school is going on remote in March, students with disabilities could have really not responded well to what was provided to our best abilities during that time. And that's based on that and based on, other factors such as, anxieties and the social emotional well-being of the student coming back to school, and how their disability kind of negatively is affected by some of the issues with a pandemic that's occurring and schools closing, that their needs could have changed drastically since that last spring when we held the end review meetings, and September when we're coming back to school. So we're cognizant of students' needs changing. The IEPs that were written in the springtime really might not really factor in where that student truly is now in September, all these months later. And that if we need to come back to CSE meetings to relook at that child's needs and update their supports and services accordingly, we would absolutely do that. So I think that's the biggest gist that Jenna was talking about.
So just to clarify further, I think the key in all of this is flexibility. And so there will be flexibility across the district with various stakeholders, with student supports, teachers, the providers, all of the individuals who are working with students that are labeled with a disability to provide the supports that they need. And so, you know, it really is that team effort working together to make sure that if changes need to be made, they certainly will. There's a process, and that process can be clarified through the special education teacher, the building principal, and the special education office. So let's transition to another poll, and this final poll. But before we put it up there for individuals to respond, I want to clarify, because a few of the comments in the chat are, you know, similar to other school districts. Will the district be offering students labeled as having a learning disability or disability the option of attending school with a hybrid model of every day? And so I just want to point out choice 3, and it's hard for us to differentiate because there's so many variables that play into that. We don't know how many families yet will choose the remote only option. And just to clarify, we've done this on other calls, that will be an option for families. There will be families that will choose to ask for only remote instruction, which is going to free up space within the classrooms to have other students. So maybe we won't end up having to have all of our students labeled as having a disability using a hybrid model. They might have the ability to attend in person potentially 5 days a week. So I just want to make sure that's clear, that that's really what that choice is. So the hybrid model is 3 days on, 3 days in person, 3 days remote. It is potentially 1 week in person, 1 week remote. It is a portion of our school setting, could be grades K1, K1-2, in every day with space, within space guidelines, or it could be in 3 through 12, you know, utilizing that hybrid model of in-person and remote, 3 days in, 3 days out, or 1 week in, 1 week out. And it could be, you know, first starting with, again, our high needs students or higher needs students based on how we've determined based on needs. It could be ELL students, it could be students with disabilities, it could be students that are, you know, homeless, considered within those categories. So there's a lot of flexibility with the hybrid model, and it is all dependent on the space and the distancing and what our final tallies will be with families choosing for the remote option. We know that families are going to select that because they're telling us that they don't want their students here for in-person instruction. So once we look at those numbers, and there will be official notification coming out on Friday for you to select what option you want for your child, specific for each child, that will be you know, out there Friday when we communicate our plans to the school community. So with that being said, I'm going to put up the poll. Let's get a sense of where people are at, and then we'll take a few more questions before we close out on our call. Okay, so if you could just take time, if you're on the call, the 236 that are on the Zoom call, if you could respond. Okay, we'll give you another 5 seconds, and then I'll share out the results. Okay, I'm going to end the poll. And as it stands, 48% hybrid, 23% remote or online instruction only, so that virtual model, and then 29%, again, in person, full return, wearing coverings all day. So we thank you for that. Just looking here to see if there's a few more questions that we can respond to. If any of the other panelists see a question that they feel like they can answer quickly, feel free to. I'm just scrolling, there's a lot on here. The question, who determines high needs, seems to have appeared quite a few times. So New York State defines students that are students with disabilities, students that are English language learners, students that are qualify under McKinney-Vento Act as homeless, students that may be receiving support services within the school setting. It might be students that are in need of response to intervention or academic intervention services. The state also defines, or at least emphasizes, primary age students being in person more regularly, if feasible. That's all in the guidance document. So that's what we're referring to as higher need. And certainly Rocco or Carrie, you can feel free to add to that if you feel that there's anything that I've missed, but that's really what we're referring to. And we know students with disabilities that are receiving specialized services that need those in person certainly take priority over some other labeled identifications based on the needs and the supports that we can provide. We know based on feedback that we're hearing and seeing that there's nothing like the in-person connection with students. Zoom does not do that for us to the extent we need, and neither does Google Meet. So that's my comment with regard to that. Rocco or Carrie, if you have anything to add.
I would just also add, that again, like everything, we're not going to set strict guidelines or parameters on that, but like special education is a continuum of services. There is a continuum. And so I sort of in my mind think about that a little bit. So at the very end, the bottom of that continuum, kids are just getting related services only. They might get speech therapy twice a week, and that's all their special education services. All the way up to kids, that are in special programs that are not even in their home schools. So the higher a kid is on that continuum of special education services, I would see also as higher on the spectrum of high needs. Now, I also have to throw in the caveat also is that in Baldwinsville, we have such a very strong philosophy and mindset on kids belonging and included in general education settings as much as possible. So our primary mode of services on that continuum is co-teaching, where kids with disabilities are in general education settings almost all day long. So we look at that also, the kids that are in co-teaching programs, how intense is their needs in those programs? Do they have a one-on-one in those settings? Are they nonverbal? Are they in a wheelchair? Things along those lines. But again, we're not making any strict guidelines on that, and it is got to be individually based, but that's sort of some general things to throw out there in terms of, my thoughts on the higher the level of need.
Thank you. Our next event is this Thursday on social, emotional, and mental health. So we encourage those of you that haven't registered for that to do so. And then we'll follow up with transportation and food services and athletics and performing arts. Again, the district, based on communication that was sent from the district office, specifically the superintendent today, we will be communicating our plan to families on Friday. There will also be more information with regard to finalizing your choices for individual students so that we can plan accordingly as we fine tune our hybrid and remote options. I am in the process right now of sending out through the chat a link to a survey based on this webinar with specific questions focused on students with disabilities. We certainly would like you to respond in the survey. If when you log off, if you don't click on the chat link right now, when you log out of Zoom and this call is ended, it will redirect you. If for some reason you get disconnected, you will receive an email tomorrow with the survey link around 5, 6 o'clock. It goes out automatically. So please provide us with feedback. Again, we recognize that these polls are just meant to be quick, give us an indication of where things are at. We're really relying on the surveys, the district-wide survey, and any questions that we do receive. So you can feel free to reach out to any of the panelists with follow-ups, specifically Rocco as our Director of Special Education and Carrie as our Director of Pupil and Personnel Services. Again, we thank you for participating. Thank you, panelists. We appreciate all of your efforts. And it is 7 o'clock, so we're going to go ahead and end the call. Thank you and enjoy the rest of your week.